everyone. I'm Alice Bell. I work for Prevention Point Pittsburgh, Pennsylvania, southwestern Pennsylvania's only syringe exchange program. And I coordinate our overdose prevention project. Mainly, I give out naloxone. Today is International Overdose Awareness Day, and while in many places people are taking this opportunity to focus on the loss of our loved ones to overdose, Prevention Point has chosen to focus today on celebrating the lives of those who have survived an overdose and who are still with us, as well as the heroes who have saved countless lives that we might have lost. So, survivors and revivers. Prevention Point started distributing naloxone to people who use drugs through our syringe exchange program in 2005. We've provided naloxone to over 4,000 people and documented over 2,700 successful overdose reversals with naloxone. We have distributed 635 last year alone. 98% of those overdose reversals have been accomplished by people who use opioids themselves. These are the heroes we're honoring today, as well as those who love someone who uses drugs and seek to protect their life, health, and well-being. Before I introduce our amazing MC for today, I wanted to take a moment to honor someone who is being commemorated at events like this today all around the world. Dan Biggs started and ran the Chicago Recovery Alliance syringe distribution program. He pioneered the practice of providing naloxone in community-based settings and is responsible for programs like ours around the world. Like with many other programs, Dan provided the example and the actual naloxone for our program to get started. Dan died last week, but he lives on in the countless lives he is responsible for saving around the world. He was a larger-than-life figure, warm, generous, compassionate, and visionary, willing to break all the rules in the service of taking compassionate action to save lives. His presence will be sorely missed, but we will continue the life-saving work he started, and he will live on in all of us. To quote my friend and colleague, Eliza Wheeler, when we think of overdose prevention, of reviving people with naloxone, we do not think of it as a simple public health intervention. We think of it as an act of restoring life, of air, of breath, of allowing for the energy in a human being to begin moving again, to be reanimated. The concrete, life-saving act of administering naloxone and restoring breath is also a symbolic act of friendship, of connection, and of a radical refusal to allow someone to die alone of a preventable death. The act of restoring life to a friend, a family member, a stranger, this has deep ripples outward, re-envisioning the way we treat each other and the ways in which we see each other and value the lives of people who use drugs. This is why we do what we do and the legacy Dan left us and the work we will carry on. And now I want to introduce another inspiring human being. You may know her as the co-founder of She Runs Southwestern PA, which is an initiative working to empower more women to running for elected office in the region. Or you may know her as a member of Lawrenceville United Housing Committee. Perhaps you work with her in your local community garden. Maybe you know her as the Democratic primary winner for the Pennsylvania House of Representatives. But we know her as a dedicated Prevention Point volunteer who generously spends time on a Sunday afternoon helping Prevention Point provide syringe exchange services. Without Sara and the many other volunteers who donate their time, we would not be able to do what we do. So on behalf of Prevention Point board and staff and volunteers and participants, join me in welcoming our Master of Ceremonies for today's events, Sara Innamorato.
Thank you all. It's an honor to be here. And before we begin with our speakers this afternoon, I want to take a moment to share how I've personally been impacted by the opioid epidemic. In September of 2009, I found myself in a situation like a lot of you here. I was finishing a shift from my second job when the phone rang. It was my stepmother, and I knew what she was going to say next. I had known this truth in my soul since my father had gone missing in July. Stoically and unwaveringly, she told me that my father was dead. His lifelong struggle with addiction had come to an end. And then she asked me to call my mother and my sister. And I'll never forget that sound that my sister made when I told her. It was barely above a whisper, it was a squeak, and it held all the sorrow in the world. I was 23 at the time, and she had just turned 21. It's a sound you never forget. Hearing that noise, how couldn't I be mad at my father? How could he do this? He had already forced us out of our house. He missed my graduation. He ruined my mother's credit. He had taken us from a middle-class suburban lifestyle to one of instability. I felt like collateral damage in his addiction. It took me years to let go of that anger and remember that he was more than his addiction. He was my dad. He was the person who forced me to ride my first roller coaster, even though I cried all the way through that line. He was the one who every 4th of July set off a firework display that was worthy of calling the local police. He was the one who put his arm around me, kissed me on the head, and told me he was proud of me that I was putting myself through college. He told me I could do anything. I loved him, and I still do. 737 fathers, mothers, brothers, sisters, cousins, best friends, and neighbors in Allegheny County have died through an overdose last year. Losing our loved ones and hearing the numbers rise, it's easy to feel helpless. I know that's how I felt for a very long time. It's easy to blame the individual, to say it was their choice. But we also need to recognize that it wasn't just individuals' actions at play. There's something more insidious here. It is the unregulated pharmaceutical companies and the politicians whose vote they buy. It's the ever-increasing income inequality that is leading to communities void of jobs, affordable housing, educational opportunities, and hope. It is the societal stigma attached to seeking help and the lack of access to affordable health care, especially mental health care and adequate rehabilitation facilities. That's why I decided to run for office. To have those fights on behalf of the weak, the people working so hard just to get back to normal. And it shouldn't be this hard. I want to fight for real solutions to build on the recent legislative wins we've had, like the passage of PA Act 139, where individuals likely to witness an overdose can legally administer naloxone here in the state of Pennsylvania. These fights, healthcare for every single person, fighting for an economy that allows us all to live a dignified life, and removing the stigma of mental health and addiction, these are long and hard fights. And while we fight for these policy and societal systemic changes, what do we do in the interim for our brothers and sisters who are deep in addiction? Personally, for me, it was about finding a cause where human beings fighting with addiction can limit their risks and come to a place where people are reminded of their humanity and treated with dignity and respect. And that's why I volunteer with Prevention Point Pittsburgh. Today, you will hear from professionals first responders, public health advocates, the survivors and the revivers, who are doing everything in their power to stop this epidemic and bring compassion and solutions to the front line of this fight. To me, it is the greatest honor to my father's memory to be here with you here today and to introduce these heroes among us. And with that, I'd like to introduce the first speaker. Since 2004, Dr. Husley has been working to prevent opioid-related overdoses through training active drug users in overdose prevention and naloxone distribution through data analysis to suggest targeted policy and intervention efforts. As manager of behavioral health analytics at the Allegheny County Department of Human Services, he has focused on helping the public understand major trends around overdose. He is a longtime supporter and a past board president of Prevention Point Pittsburgh, where he volunteered for overdose prevention efforts early in the epidemic. Please help me in welcoming Dr. Husley.
All right, I got a couple of notes, so I'm sure not to forget a couple of points I was encouraged to emphasize. So,
well, thank you, each of you, to be here. I think it's kind of a testament to what an important issue. Yes? Is that okay? I'll bend over a little bit. All right. I think all of you here today, I think it's quite a testament to what an important issue this is for our community and all the different sectors, whether you're government, a community organization, or just a resident in the county. It really does affect all of us. And so I'm pretty honored to be asked to speak today to tell you the story that I experienced maybe 10 or 12 years ago as a volunteer with Prevention Point. And this was early on in the overdose prevention program, where we were beginning to distribute naloxone to participants for needle exchange services. This was a normal Sunday afternoon. The services at the time were from 12 to 3 p.m. I was there volunteering. With Alice, who had trained me to do overdose prevention trainings, and we had volunteer doctors writing prescriptions for the naloxone. And we went through the day. Can't even remember how many people we trained that day. It might have just been a handful at that time. It was close to 3 o'clock, and all of the volunteers would gather up all of the supplies, put them back in the boxes, and pack them away for storage for the next week during the needle exchange activities. And here comes around, and this used to happen, it was actually the old adolescent, it was the juvenile jail site. It was not as pleasant as perhaps the sites today, but someone had come around the back parking lot. And it's like, sometimes people will come towards the end. You always have those, no matter what job you got. It's always people coming at the end. They were showing up, and there's two guys showing up, and he says, well, what is going on here? And the guys seemed pretty frantic, and he said, my friend. And me and another volunteer who was also trained in overdose prevention at the time had gone over to the car, and when we looked at him, we recognized it's a pretty serious situation. He was not responsive. He was pretty ashen, and he was laying in the back seat. It was scary as hell, I can assure you that. As a volunteer, I did not expect to kind of encounter that. And so at that point, we really didn't freak out. Sometimes in crises, I feel like I get even more calm, which is the kind of opposite response. But what happened is the overdose prevention training really just kicked in, and it's a fairly simple training with just sort of simple, precepts there. You say, one is, check for responsiveness. We were pretty clear that he wasn't responsive at the time. Two was to check if he was still breathing. see if you could stimulate him to wake up or to even respond, if we could arouse him. He was actually breathing at the time, and the volunteer I was working with, she was listening and feeling to see if he was breathing. And he was, so we were just saying, oh my gosh, what should we do here? And we looked at our site, our coordinator at the time, Ron Johnson, who sadly we had lost earlier this year, very good man and a dedicated leader in this work. And we said, let's go get the naloxone. So we went back in, we got that. I administered it in the thigh, just as the training recommends. We were intramuscular. And, wait 3 to 5 minutes for the person to respond. I can assure you that every minute is about a century. And so I can't verify that I waited the full 3 to 5 minutes. I hit him again with the 1 cc, and very shortly after that, you could see that blood flow was coming back into his face, and he was beginning to breathe again, and woke up kind of groggy. We had the security person at the health department come over, and he thought the person was diabetic, and he was trying to offer him help and a soda, and we're just saying, I think let's give him a few minutes. But he was just a little bit groggy, and we had already called 911, and EMS had responded really, really quickly. And we kind of just told him what had happened, and his buddy had to leave. I don't know why, but regardless, we were able to help him out that day, and the paramedics took him away. And I think we heard he was going to be okay. And that was a pretty convincing, experience for me that this stuff works. And I've sort of been a pretty strong advocate ever since. In my role now, doing a lot of data analysis, it's pretty dry. But just pointing out these trends, I sort of keep that and other kind of experiences working, directly with folks affected by this stuff in my mind as I do this work, and try and make for this information to be meaningful, that we can all rally around these points to guide our efforts and kind of reduce this, terrible situation that we're in Allegheny County. If you're interested in reading any of that stuff, you can find that on AlleghenyCountyAnalytics.us. It's focused on Allegheny County and highlights all the trends on what we see with opioid overdoses. And then if you haven't already, check out the tables for Prevention Point and for the health department. Some pretty dedicated folks are here, and you can get naloxone today. The training's really simple, and you might be able to save a life yourself if you're equipped to do so. So thanks again for having me, and all of you, just keep up the great work. You're obviously committed on being here today, and I just can't encourage you more. So.
Stacey Brown is our second speaker. All right, give it up for Stacey. She has been employed by ONALA Recovery Center as a certified recovery specialist since February 2013. She helps assist individuals locating treatment, finding recovery houses, and any other resources they might need. She is a person with lived opioid abuse experience and was personally revived with naloxone in 2005. She is now dedicated to finding solutions and ending stigma around addiction. Please join me in welcoming Stacie Brown. I need that energy back. All right.
Good afternoon, everybody. I'm Stacie, and I'm a woman in long-term recovery. And whenever I get the opportunity to speak, I get real emotional, so please bear with me. But this is very dear to me. In 2000, let me just start by saying, since my mid-20s, I've struggled as a heroin abuser. And several attempts at trying to get clean, and they've all failed. 2005, I overdosed. And it took 3 doses of Narcan to revive me. And I remember the feeling, like I don't remember anything about that day except for what my main purpose was. But I remember the feeling of waking up and I had all these people around me, police and paramedics and neighbors, and everybody was staring at me and I was hysterical. And the paramedic said, "Do you know what happened?" And I said, "No." And she said, "You had overdosed." And I said, "I can't die. I'm a mother. I'm a daughter. I went got clean. From there, I had about 5 years of maintained recovery. And I was just really basically abstinent. My journey didn't really start in recovery until this time around. I have 6 years clean and sober, June 1st. I had about 9 months clean, and I had went into ONALA Recovery Center just to volunteer because I needed to keep busy, and they ended up hiring me, and I've been there ever since. That has been the best choice in my life besides putting the drugs down. This probably within the last 3 years, I've been really actively doing the Narcan. A good friend of mine, also Ron Johnson, sort of edged me into it because of my passion for it. Last year, I did 670 Narcan trainings. So, and I don't care who you are. I don't care if I'm on a bus. I always have it on me. I'll do the training. If we're at Giant Eagle, I've trained everybody in my family, even my daughter. Listen, what I want you to understand is we're human. Like, and I say this all the time, when somebody hears of an overdose, you automatically think that person died. We survive. And a lot of us live good, happy lives, not getting high anymore. You know, I made a bad choice, but that doesn't mean I'm a bad person. I have 2 beautiful daughters. I'm a grandmother of 3. You know, I'm a wife today. I'm a daughter to my parents. I'm employable. I work hard at my job, and like, this is my passion. I'll help anybody at any time, from training on Narcan to getting you into treatment to finding sober living, just talking to. But I just want everybody to understand, like, the stigma has to stop about the dirty addict. Like, we're people. We deserve to live. Like, and I was so nervous when I was coming up here, but I'm like, this is you. This is what I do every day. You know, I love my job. I love the people I've met. I like just helping people. You know, I've also revived, unfortunately, at my job, we've administered Narcan on 5 individuals that came in maybe for a meeting or maybe to get help. And 4 of those individuals are still alive today. 3 of those individuals are still clean today. So, I mean, it's out there, the information's out there, and if you are afraid or if you know somebody, please, I'm over at the table. Just stop over. I'll be glad to point you in the right direction if I can't help you. And Prevention Point is so dear to me also because, like, they gave me the opportunity to get out there, and Alice has been a big part of it also. Like, they stood beside me. They helped me to educate other individuals. So if you have an addict in your family or if you know of one, support them. They're really not that bad of a person if you get to know us. We're really not. I promise you. And I want to say thank you for allowing me to get up and tell part of my story.
We're doing something really special here, sharing our stories. I'd like to welcome our third speaker this afternoon. Simon Taxel is a crew chief and public safety driver with the Pittsburgh Bureau of EMS, a medical specialist on the Pennsylvania Urban Search and Rescue Strike Team, and contributing author of the Journal of Emergency Medical Services and Continuing Education Solutions. He has written extensively about the role of emergency medical services in harm reduction and the opioid crisis. Join me in welcoming Simon Taxel.
Good afternoon. Can everybody hear me all right? So I had some notes prepared, but I think I'm going to take a more extemporaneous approach. After hearing everybody speak, there's some more important things to say than what I had written down initially. Just sitting here now, I had somewhat of an epiphany. The overdose and opioids and Narcan is nothing new to EMS. We've been out there in the field treating people who have acutely overdosed for decades and decades. But what is new to EMS is harm reduction. And if we hadn't reached the crisis point that we're at now, where in 2017, 72,000 Americans died from overdose, we wouldn't be here having this conversation today. We wouldn't have worked, and the people that organized this wouldn't have been empowered to bring all these stakeholders together to try and create change. So for the last 30, 50, 100 years, the members of our community that have suffered from opioid addiction and addiction in general have been living in the shadows and living out of reach. And now that it has reached a true public health crisis, we're doing what we need to do to bring that community back into the fold. And above all else, I think that's the most important work that we're out here doing. And as a group, what we're going to do that makes the biggest difference is find a way to embrace these members of our community again. So if the crisis has any value, I think that's what it is. And so we can now, as a group, move forward and start to make positive change. And that's really important. As a paramedic, as I said, I've been administering Narcan as long as I've been in the field, for almost 15 years. But I am relatively new to harm reduction. My personal journey with harm reduction started now that I have two people in my family circle that struggle with addiction. And they are two men that love their children, that love their wives, and whose lives have value and purpose, and who suffer and who need help. They're not outcasts. They're not people that have no value to the world. They're people that are important and who we need to help heal. And so to approach that from a more compassionate and holistic perspective was important for me. Because you have to understand, the dark places that the state representative shared in her story, that's where I walk every day. Those worst case scenarios are what I do every single day when I go to work. And in order to be effective at my job and to have this uniform on and be good at it, you have to approach the work dispassionately. And you have to armor yourself so that that emergency doesn't become your emergency, because you have to manage that situation, and then you have to manage the next one and the one after that, and then you still have to go home to your family and be a real person. And so harm reduction requires a level of compassion that is well beyond what we normally do in EMS. And we're making progress, we're doing the right things, but there's a long way for us to go. Our education as EMS providers is severely lacking in addiction and mental health and anything beyond how you medically manage a person who is acutely overdosed. So we need to build infrastructure in the healthcare community, I think at all levels, that teaches people about the needs of this community and how to interact with them and how to help them beyond just administering Narcan. And we still have a long way to go, unfortunately. But as I said, we're making progress here in the city of Pittsburgh. We've been doing Leave Behind Narcan for a year now. It's becoming very, very effective. We're also working with the Connect Community Paramedic Program, and we're referring people to a direct outreach social services program that they're sponsoring through grant money, and I think it's going to be very, very effective. In the future, there's more that we can do, though. I want to see us to introduce fentanyl test strips to our Leave Behind Narcan kits. There's very, very strong evidence that providing those materials to that community will help them alter their behavior. I want to see us in EMS as doing needle exchange in the field to help prevent hepatitis C and the spread of HIV. I know it's a political hot button issue, but this isn't politics. This is public health, and this is stopping the spread of disease and saving lives. I call on the state representative-elect and any other government officials here, that's against the law right now. And we need to change that. We need to change that yesterday. And once those rules get changed, then we can increase the harm reduction that we're doing. We're also working on developing a program where we divert patients from going to the emergency room and transport them directly to a treatment facility. And I think that's going to be one of the most important things. Our emergency rooms do really, really important, vital work, but they're not equipped to get the outreach that these community members need. So we're working on that, and hopefully it'll continue to move forward. There's also some logistical and legal barriers with that we're going to need the government's help and our representatives' help with. I'm putting you on the spot, I'm sorry. In conclusion, in my own learning process about addiction and about harm reduction, I read something that describes addiction in a way that I think is really important. This was written by a Canadian physician named Gabor Mate, and when I read it, it was just this moment of epiphany, and so I wanted to share it with everyone. Addiction is neither a choice nor primarily a disease, genetic or acquired. It originates in a person's attempt to solve genuine human problems, those of emotional loss, of overwhelming stress, of lost connection. It is a forlorn and ultimately futile attempt to solve the dilemma of human suffering. And I think that really encompasses what addiction is and why it requires a multifaceted and holistic approach to solve it. It's not a disease that can be cured with a drug or surgery, and it's not a mental health condition that is purely organic. It falls somewhere in this nebulous area in between that we don't understand very well, but we need to do better. So, thank you very much for letting me share. It's great to see everyone here.
Looks like I already have some work assigned to me. We're going to welcome another public servant. Raina Lewis is 51 years old and has worked for the City of Pittsburgh for 21 years as a paramedic. Born and raised in the Lower Hill District, she has been involved in her community throughout her career and has been on the COPE team for the past 6 years. Please join me in welcoming Raina.
I think Taxel just stole my thunder. We should have stood together. But anyway, I've been working for the City of Pittsburgh for 21 years, and I'm originally from the Lower Hill District. So I call myself the Pittsburgh kid, because I'm just that city kid. I was born and raised in the city. I got that city mentality. I'm not that book smart individual. I'm just raw. So when I first started out in EMS, I had the street mentality. I could recognize some of the things that went on out there, and you know, we had our restaurant and bar on the Lower Hill District. So I saw a lot of things at a very young age. And so I could relate to a lot of things that was going on out in the community. So as I came on the force with Pittsburgh EMS, you know, I was always taught to respect. That was my dad's biggest thing. You know, we gave away free food. at our restaurant, we fed the needy. We fed people down on Aaron and Wiley, and you guys have probably heard of Aaron and Wiley back in the day. So, you know, I've always been around the inner city life. So I worked on the Hill District for a long time. It had its ups and its downs because every time I would come on scene of a drug overdose, it would be someone that I knew. And that kind of made it tough on me because at the same time, I was trying to stay focused with doing my job, but at the same time, it took effect on me because it was personally taking its wear and tear. So then I moved out into Homewood, and then you started to see the same trend occur in other neighborhoods and other neighborhoods. So I said to myself, Raina, don't run away from things. This is what, you know, God has called you to do, and this is, you know, this is what you need to do. But the one thing I've always had and I've always been really big on is respect. That is the biggest thing, and that is the biggest thing with me. You have to respect what's going on out there, because at the end of the day, it's your mother, it's my brother, it's my nephew, it's someone that we know that's out there that's addicted. And they're actually needing you to help them in their recovery and finding them the resources and getting them the help that they need. And just loving them because they're actually going through this pain and suffering. So that's my big thing. You know, I always said, you know, our dreams can be accomplished, and our fears is always the one thing that we're so afraid of. It's a battle. You know, it's a hard thing to overcome. But just that person understanding and being there with you and not judging you and being honest with you, because that's another thing too. Don't baby them. Don't, you know, just be honest and try to get them the help that they need. And I go home a lot of times, I don't like to wear the uniform because the uniform is not me. My heart is me. So I would rather not wear the uniform and just be me. And that's my whole thing. So I just want you to know that if you continue to pray for me and us in uniform where we're out there trying to do what we need to do, I will continue to pray for you and your family members as we, you know, go through this journey through life. And we will all together, you know, make this work and we'll make it happen. But I'll reassure you that every day that I'm out there and Simon's out there and Pittsburgh EMS is out there, we're going to do our best to make sure that we take care of your family and loved ones 100%, because that's what I'm going to give it, 100% every day. So thank you.
Can we just give our first responders another round of applause? So our final speaker this afternoon is Jordan Coughlen, who is entering his final semester of graduate school at the University of Pittsburgh studying social work and public health. His personal and professional experience lies in serving marginalized and underserved communities, and this passion has taken him across the country and around the world. Jordan is a strong advocate for harm reduction, naloxone access, and the multiple pathways of recovery. Please join me in welcoming Jordan.
Hi, everybody. Can you hear me? Yeah? Okay. Thank you, Sarah, for that introduction. It is amazing to see so many passionate people here today and so many friends to make me nervous. I'm honored to be with you on International Overdose Awareness Day as we celebrate and honor our brave and beautiful survivors and revivers. It is incredibly humbling to stand here as a fellow survivor of an opioid overdose. The only reason I am here today is because of the rescue breathing my mother gave me, the swift action of paramedics, doctors, and nurses, and the life-saving reversal drug naloxone. Thanks to Act 139, the Allegheny County Health Department, and Prevention Point Pittsburgh, naloxone is available here today and every day through a standing order at your local pharmacy. Because of naloxone, my family, EMS personnel, and medical professionals have the gift of being here with you and identifying as a person in long-term recovery. In my experience, I have found certain concepts and basic values to be necessary and imperative in the work that we do and how we treat others, something that I like to call the gospel of harm reduction. This gospel is one of acceptance. It's about meeting people exactly where they're at for exactly who they are. People who use drugs are not to be feared. The gospel of harm reduction is an active practice of non-judgment. It is a work of miracles, seizing the opportunity to transform fear into love. I would not be here today without love. The gospel of harm reduction reorients perspective and power. It eliminates hierarchies, social constructs, and complexes, and it helps break down the walls of you and me and reveals the power of we. The gospel of harm reduction was not taught to me overnight, nor do I expect anyone here to learn it that quickly. It was learned through people in my life that served as role models of behaviors, beliefs, and basic humanity. I discovered the love, patience, and physical presence of people willing to meet me where I was at, people who entered into my story, suspended personal judgment, saw beyond symptomatic behavior, and looked me in the eyes. These individuals showed me who I was, which was a person first, a person far more than an opioid use disorder. Dr. Seuss once said, "Sometimes the questions are complicated and the answers are simple." I'm not going to stand here and lie to you. The practice of harm reduction is simple, but it's not always easy. However, I believe that if we are honest with ourselves, we know that none of the good, true, and worthy causes in our lives and in our world and in our community are ever easy, but they are worth it. We as people, professionals, citizens, revivers, and survivors have a responsibility. But rather than being responsible for people, we are responsible to them. A person's decision to use substances is not about us, nor is it an act against us. I believe this mistaken belief is what stirs the pot of stigma. It is what prevents swift and effective legislation change, and why overdose awareness and the celebration of survivors and revivers is so important. The question again of solving this epidemic is complicated, but harm reduction, the answer is simple. Practicing the gospel of harm reduction before, during, and after an overdose requires that we honor the inherent, incomprehensible worth and value of each and every individual that we encounter, not because of their use, but because of who they are as a person. It requires that we act as a mirror of truth to others, reflecting their worth and value back to them, while offering the gift of forgiveness. In offering the gift of forgiveness, we empower them to forgive themselves. Because believe me, I know firsthand that there is no harsher critic of someone who uses drugs than themselves. The gospel of harm reduction asks us to treat others as people with potential, not people with problems. It asks us to acknowledge and empower their autonomy, listen to their wants and needs, involve them in self-directed treatment, and support them in the discovery of their hopes, their dreams, and their goals. The gospel of harm reduction allows us to treat people as unique individuals, of whom traditional models, therapeutic frameworks, and abstinence-only approaches may not work. The gospel of harm reduction is exciting because we get to challenge ourselves and others to think outside of the boxes we often feel stuck in. We are privileged here to empower others to write a new chapter in their lives and give them the tools and resources to do so. Living this gospel forces us to shine a light on trauma, social injustice, and stigma's foreboding darkness. In doing so, we teach people that where they see pain, we see resilience. Where they see scars, we see survival. Where they see loneliness, we see an opportunity to love. This, my friends, is the essence of harm reduction, and when it is put into practice, it not only becomes natural and freeing, it becomes gospel truth. Thank you.
I'm much shorter. Okay. So while overdose deaths have increased over the last several years, naloxone is easier to access than ever before. Folks are able to purchase naloxone without a doctor's prescription at their local pharmacy, and most insurance providers now cover part, if not all, of the naloxone prescription. An increasing number of organizations are doing naloxone distribution, such as the Allegheny County Health Department, which is right over there. You can go over and grab some today. It's easy to use, and the training videos are actually right online. Prevention Point Pittsburgh website has a number of great videos covering how to use these different forms. And since this is a day of awareness, but also celebration, I again want to acknowledge the numbers that Alice mentioned in the beginning. So in 2017, Prevention Point Pittsburgh documented 635 successful overdose reversals through reports back from our participants. That's 635 lives that are still here because of the work that you're doing. Let's give it up. And police around Allegheny County also have reported back 666 successful overdose reversals. And before we depart today, I just want to say a few thank yous on behalf of Prevention Point Pittsburgh. Thank you to our sponsors, Allies for Health and Well-Being, Stoughton Farm Foundation, PAC Clinic of UPMC, Coordinated Care Network Pharmacy, All of Us PA, the Jewish Healthcare Foundation, Oste's South Hill Pharmacy, and Aetna for helping us make this event possible. Prevention Point Pittsburgh would also like to thank the City of Pittsburgh for your partnership and the Allegheny County Health Department for supplying naloxone for today's event. Thank you to all our community partners tabling today, and to our speakers for sharing your stories, and for all of you for coming out and sharing your support. The Harm Reduction Fair will go until 4:30, so make sure you stop by all the tables and pick up some swag. And then after Prevention Point Pittsburgh, we'll be heading to Modern Cafe for a Narcan party, happy hour starting at 5 p.m. And we'd love to see you all there. Thank you all so much, and have a great day.